Question 3 is, what is the difference between LASIK and PRK? So maybe we can just define a little bit of the difference between the two procedures, but then also what would be some reasoning why we would recommend one procedure versus the other?
Well, LASIK and PRK are very similar procedures. The only difference between the two is the presence of a flap in the LASIK procedure. With PRK, there's no flap. The laser treatment is done right on the surface of the cornea after the skin on the surface of the eye is removed. With LASIK, a very thin flap is made. It's typically about 1/10 of a millimeter thick, so it's extremely thin, comprised mostly of skin cells and just a little bit of the tissue that's beneath the skin. So what is the advantage of LASIK? There's only one, and it's faster recovery. And that's why most people who undergo laser vision correction prefer to have LASIK. They're young, they're healthy, they're busy, they've got work, they've got activities, they want to get back to those things much more quickly. But for those who are only candidates for PRK or those who prefer PRK, there are advantages to PRK. With PRK, there's no flap. So as rare as it is, there are occasionally some complications related to flaps. For example, wrinkles in the flap or debris under the flap or a displaced flap. These are very rare things, and it's extremely unlikely it would ever occur, but for some people, they just might feel more comfortable doing PRK. If there's not enough tissue to make a LASIK flap, and there's enough tissue to do the laser treatment, then PRK may be a better choice. And then there are some patients who may be better candidates for PRK based on lifestyle. For example, if they're into martial arts or some activity, whether it's police or military work, where they may be more at risk for taking a blow to the eye, they might prefer to do PRK so that they don't ever have to think about having that flap traumatically displaced. It's very rare, but these complications occur, so some people prefer the more conservative option of PRK. We do both of these procedures. The results are the same.